Hi everyone. I'm doing the week 12 discussion. I'm in group 1. The discussion topic this week is home care crisis. Um, it says first to describe the problems faced by elders who are caregivers to their adult children and grandchildren. I would have to say that some of the problems that they face, one of the first ones would have to be just the stress of actually taking care of your kids or grandkids when you should be able to relax. You're not normally as physically capable as you were when you were younger. So, for example, the adult children who have disabilities, it talked about in the textbook that it's harder for the parents because they need to keep caring for the children even as they get older, and that then they also have to have a plan for the children after they have to be in a nursing home or after they die, because if they don't have a plan, then their children might not have help, and if they don't have a job, they wouldn't know how to take care of themselves. So it's kind of complicated for them. Same thing with them trying to raise their grandchildren. They have to have a plan. If they died before the grandkids were 18 or old enough to live on their own, then they'd have to have a good plan for the kids for where they would go. And let's see. Explain the home care crisis due to the growing demand for home care workers. And why don't people flock towards this occupation? Well, I think that people don't flock towards this occupation because, like in the textbook, it says that many times they're not paid much. In one of the videos, it says that there isn't even a minimum wage law for the home health care workers, which I think is just wrong. Like they considered it to be babysitting, and it's like, no, it's more than just babysitting. You're taking care of people that need help, and yeah, so I think there should be a minimum wage law for that, and I guess that would probably help people to be willing to do the job. Also, that the job doesn't always have good benefits. And another one of the videos was talking about how the people who do the home health care worker jobs normally live in poorer families. They're normally minority populations who get the job. So it's obviously not a wanted job due to the low level of income that you get. Doesn't have very good benefits. And even like when it was talking about the workers don't want to support people wanting to care for their own parents because it would cost too much money or take away from their time at work. And it was saying that the middle-aged women are going to be the people who are helping to raise the labor force, the growth in the labor force. Middle-aged women are going to be helping with that, and they're the people who normally end up caring for the elderly. So yeah, I think it would be best if we came up with ways to improve the money that these people can get, and also flexibility in various jobs would be good too. That kind of answered valuing the occupations more. Has your family ever spoken openly about they want as they get older? Yes, my family has. Mom and Dad talk about it. Because we live on a farm, they've kind of talked about how sometime we could take over some of the farm, like one of us could help with that, or they've when they put on a master bedroom addition downstairs, they made sure that all of the doorways were wide enough for a wheelchair to get through. They made sure that the bathroom was accessible. They planned it so that they could stay in their home as long as possible. And they've talked about that unless if it really got bad, they'd want to stay doing that. And we just keep telling them, okay, but don't go out and be throwing hay bales by yourself once you get older and can't move around as much, because we don't want something to happen to you out there. So it can end up kind of funny sometimes, but yeah, it's good that we talk about it. Gives you a plan. You kind of know what's gonna happen. And right now, I mean, they're both fine. They're both in good shape. So hopefully nothing will happen for a while anyway. As far as me, I've thought about it little bits, but because I don't have like my own home yet, I mean, I haven't really talked about it too much. I just know that I probably want to age in my own home. I think I'd prefer that. Yeah, and then just the last thing was I was supposed to reflect on the video links. The one was horrible with Australia. Yeah, that was just terrible for all the things that happened to the people in those nursing homes. And also the other things I said, like the minimum wage law, various characteristics about the home health care workers. I thought that was sad, and they need to get some more work. And then the last one was talking about family relationships and like how you can resolve those and make sure that you're talking about aging with the rest of your family. And that was pretty much it. Thanks. See you next time.